Hi, I'm Dr. Dezetta Burnett, and I'm going to walk you through the Clinical Comparison Library, a study platform I built specifically for MSW and counseling students preparing for comprehensive exams. What makes this different from textbooks or Google? There are three things. There's a side-by-side comparison table, not just list of criteria. There's exclusion reasoning and justification language, what faculty actually grade, and there are clinical vignettes to practice applying what you've learned. Let me show you exactly how this works. So when you first sign on, you will see your account details, your account access, which is your status. It tells you the status of how many days you have left and when your subscription expires. You have, like, for instance, this is 24 days and it's counting down. And then we can click go back home. On our homepage, we have our learning dashboard. And what this shows is, again, how many days we have left, how many days we've been studying, did we achieve anything, any badges that we achieved, and then community weekly leaders. And so here you can sign on to see who the weekly leaders are. Okay, we're going to go back one. Also, there are 1 and 9 categories. So as they're counting, there's 9 categories. So I've completed 1 and 9. There are 103 flashcards. I haven't taken any quizzes, and my average score is not here. I can click here to start learning, but I wanted to show you some of the quick access tables that are down here. There's a test bank, there are worksheets, there are mnemonics, there's the quiz section, flashcards, and disorders. So let's take a look at the test banks. The text banks come with 158 questions from different categories, as you can see. That's the test bank. And you can go back to the dashboard down here, worksheets. So there are worksheets for every diagnosis and comparison. Here are the worksheets. Either the similar worksheets or not the same worksheets that you'll see on each section of learning. Here are your worksheets, and you can print them out or save them as PDFs. They're mnemonics. So here are mnemonics for almost everything. Mood disorders, personality disorders, psychotic disorders, differential diagnosis, feeding and eating disorders. So those are your mnemonics. Quizzes, right? The quizzes are similar. You can click a smart quiz and decide, like, let's say we're going to do psychotic disorder. We'll start taking a quiz, and there are 5 questions just to quiz you to test your knowledge. You go back to the dashboard, flashcards. So again, if you can't remember, this is a mnemonic for general anxiety disorder. So GAD mnemonic is worry me, right? And it goes through what the mnemonic is: the worry, the out of control feeling, the restlessness, the rapid fatigue, you can't concentrate, the muscle pain, exhausted, and the duration. So there are 103 cards there. Disorders. So now this is the section of each disorder. Psychotic disorders, for example, and this is what it looks like when you go into the psychotic disorders, right? First, we start with like the foundation of what a psychotic disorder, the overview. Then we put here the mnemonic for these symptoms. Then we move on again to another mnemonic for the symptoms again. The duration, how to remember the duration, less than a month, 1 to 6, 6 months or more. And then a full comparison table, which I think is unique. I created this when I was teaching in a psychology program because people really struggle to learn the difference between schizophreniform versus schizophrenia versus schizoaffective. And when I created this table, it made it easier for students to recall and really understand. And so for there, I just started making tables. And then here are the quick differentiators. You get the vignette section. For every diagnosis, there's a vignette section. Um, and then there's study tools. Again, so what was in the dashboard, you can come here. Now that you've completed this section, you can take a quick quiz. You can have flashcards. You can practice the diagnosis, or you can listen to the summary. And so I think that's pretty cool. And let's say you have a question and you really can't figure out, like, what is it? Like, what is psychotic disorder? You can come here and talk to the study assistant, and it will help you in real time compare the diagnosis or explain a disorder to you. which I think is unique, especially in the space that we're in. Yes, you could use an AI system, a chat GPT or something of that nature. However, this is like a studied environment. So when you're going back and forth, it's hard. And so this is just like one section. If you had a quick question, you can jump over there. And um, so I think it's important when you look at the full comparison. I want to go back up to the full comparison. Right. So seeing how it all comes together when we're talking about this side by side, it lets you know like the core difference, the duration, the symptoms, the functioning, and then like key features. And this is what takes hours to piece together when you're going through a textbook. So what I've done is I put it all together for you in one place. Knowing the criteria is one thing, but applying them is another. And that's why we include the clinical vignettes when we get down here, right? You can know the criteria, but what does that look like? So here's an example. I'm going to read one to you to make your diagnosis and then show you the diagnosis. There's a 25-year-old man that presents with 3 weeks of auditory hallucinations, telling him he's chosen for a mission, disorganized speech, and declaring self-care. His family reports his functioning normal. He was functioning normally until symptoms began abruptly after losing his job. He has no prior psychiatric history. So that tells me a few things. When we're looking, it's been 3 weeks. So if we look here, this is a good example. 3 weeks is brief, right? He didn't have any symptoms before. And so if we look at any of the other disorders, if we were to go to this comparison site, psychotic disorder is 1 day to 1 month. You only need one or more symptoms and then you return back. But the keynote is there's a stressor. And in this situation, he lost his job. We know that he would not meet the criteria for schizophrenia. We could look at schizophreniform, but that's a provisional diagnosis. But what we and delusional, that's a month or more. But if we look at the timeline, it's only been 3 weeks. And so we have to start to think perhaps this is, we ruled out the other things. What could it be? And it would be brief psychotic disorder. Here's where it breaks down the why, right? And so why this fits is the duration is less than a month because the symptoms for 3 weeks. Their presence of positive symptoms, which are those auditory hallucinations and disorganized speech. And we have an identifiable stressor, that job loss. And again, it was an abrupt onset with no prior psychiatric history. So I've already went through the why just because that's how I think of the rule outs. Why not the other one? So we know that's schizophreniform because the duration is less than a month that he's experiencing symptoms. And with schizophreniform, you need to have 1 month to 6 months. Schizophrenia, we not schizophrenia because the duration is 6 months or more, and not delusional disorder because the hallucinations and disorganized speech are not just delusions. So that is how we get down to rule it out. But this is practicing the skill that faculty evaluate, not just naming the diagnosis, but defending it. Okay. So that is our vignettes. Now let's take a look at some of our quick questions. We went brief psychotic disorder last, and we just went through this. We can look exactly 2 weeks. No, it does not last exactly 2 weeks. I'm going from bottom up. More than 6 months. No, we know that more than 6 months could be schizophrenia. Um, 1 to 6 months. No, we know it's not 1 to 6 months because that's schizophreniform. And less than 6 months, yes, because that is brief psychotic disorder. So we want to know what's the minimum duration, what happens during this duration, and then this gives us an idea. These are the details that separate passing from failing on these exams. Okay. So now let's look at the AI study assistant. So here, now you're going to let me show you the study assistant that is like having me 24/7 to answer your questions. So let's type in the difference, the question, what is the difference between schizoaffective disorder? I'm sorry, I'm typing slow. And brief psychotic. I don't want to make any mistakes, but I made mistakes anyway, right? So that's the question we're asking. It's going to think about it. Seems like it's moving a little slow, but you got to remember everybody's using it. But here we are. It gave us the full example of what it is, right? So when let me come up in clinical comparison library, this is how you distinguish it. Brief psychotic disorder centers primarily on duration and the relationship between mood and psychotic features. It gives us the symptoms last a day but less than a month, followed by return. Schizoaffective is long term. It requires a period of at least 2 weeks of psychotic symptoms in the absence of a major mood episode, though the total illness includes a persistent major mood episode. And then it goes further to talk about it, the functioning, the comparison table. It doesn't look pretty here, but it's just a quick note in case you had any questions. Okay. So see how this gives you a clear, structured answer with key differentiating factors. You're able to quiz yourself. This is the kind of reasoning you need in exams. Okay. That's the clinical comparison library. Let me quickly cover how it works. And I can't really get back to the payment page, but let's go home. There's a one-time payment of $19. There's no subscription. You have access to 150 plus, as you saw from what I showed you, diagnostic comparisons, the clinical vignettes and practice questions. You have AI study assistant, and it's all organized for your exam prep, right? That's for the students. For the programs, it's a little different. There's team access with a seat-based licensing. There's an admin dashboard. There's a usage tracking for progress, and there's the pricing, which is $8 a seat. But if you're a student preparing for a comprehensive exam, you can get instant access at clinicalcomparison.com/students. And if you're a program director or clinical supervisor interested, reach out to me. But I just really wanted to give you an opportunity to take a look at this to see if it's something you'd be interested in. And also because it's a platform that has a password and for proprietary, protection, I don't give in my intellectual property, I don't want to give the whole thing out. And I think it's a situation where it's only needed for so long. You don't need it for a lifetime. I think you can get what you need over the course of a few weeks. But I hope this is helpful for you, and I look forward to working alongside of you as you learn the DSM and you learn how to clinically compare diagnostic criteria. Thank you.